So from these guidelines, these are the things that you should expect from your oncologist. Number one, you should expect a discussion of possible infertility before treatment begins. I have to emphasize this once again. This discussion should happen before treatment begins. It's crucial that if you want to undergo fertility preservation, that you undergo some of those treatments before we start treatment. That's usually when it is most successful. Second, you should really have a discussion of any known and unknown risks of your specific therapy. For many of our modern cancer therapies, the risk of fertility impairment is actually unknown. But even that should be a conversation that you have with your provider. Third, if you are interested in fertility preservation, or even if you're unsure about whether you're interested, you should be referred to a fertility preservation specialist. Depending on who you are as a patient and where you live and your general care environment, fertility preservation specialists may be reproductive endocrinologists or men's health specialists or a separate independent sperm bank or egg bank. Fourth, you should be able to revisit fertility discussions with your oncologist or oncology provider during and after treatment. So even if, for whatever reason, you were unable to have a discussion about fertility preservation before you begin treatment, that discussion should happen after your treatment, because fertility preservation in many cases is still possible. It just has a smaller chance of success. However, you can always try and squeeze in a fertility preservation cycle after treatment or in between your treatment cycles. And this often can be met with significant success. Finally, you should be referred by your medical provider to supportive services such as social work, mental health, financial counseling, and/or genetics. All of these supportive services make the decision to pursue fertility preservation and the actual logistics of making it happen much more feasible.